And our next open house tour is we're going to go up to UC Davis, to the health center, to the UC Davis pharmacy. And with that, I am going to turn it over to the pharmacy team.
Hello, we're Team UC Davis Health Pharmacy. Our student team includes myself, Yuna, Bernardo, Daniela, Sujai, and Carrie as our practicum mentor. We first want to introduce our MIP Chris Ong, who's the pharmacist on the informatics and analytics team at UC Davis Health. He's been an incredible help to us delivering our project, and we're extremely grateful to have him as our guide and a mentor. The Cancer Center at UC Davis Health carries expensive medications, which must be prepared individually for each patient. And this is why one of the many important roles of the pharmacy team is to manage medication inventory and usage data to ensure timely future orders. Currently, the data sources work independently, so there's no visibility to track inventory as one holistic view. So our solution is to develop a comprehensive dashboard, which Sujai will be explaining more in depth.
Thank you, Yuna. Next slide, please. Yeah, so as Yuna mentioned, we would be unifying the data models into one, and we would be building a dashboard in Tableau. So currently, the scope that we're aiming for is to include 45 different medications that are used in the Cancer Infusion Center. And we aim to display around 23 different metrics in forms of visualizations. And the impact that we're looking forward to drive is to mainly reduce overstocking, which could potentially reduce the waste incurred in the cancer center. This waste could potentially save a lot of money because it's pretty expensive. And apart from that, we also aim to reduce the treatment delays cost because of this, and also to increase the visibility of the dashboard across the pharmacy team. Over to Bernardo.
Thank you. Thank you, Sujai. Next slide, please. Yeah, so here we have a current work in progress dashboard with certain metrics that we've developed. Listed, we have the purchase count and expenses, quantity shipped in the last number of days, inventory count, vend-to-refill ratio, along with filters, including medication. And like Sujai mentioned, we're currently working in Tableau. And as we continue to flesh out and validate our metrics, we will continue to add them to this dashboard and then set the visualizations according to our stakeholder specifications. Over to Daniela.
Thank you, Bernardo. Next slide, please. We just want to share with everyone what our biggest learning has been so far. And I just want to stress on the importance that we got to understand on comprehending the problem, like really making a clear problem statement, understanding what our stakeholders' needs were, and identifying the core issue of the initial situation that we were working with, and then look at how data and our analysis can help us solve that. I feel like as junior analysts, sometimes we have an urge to just like dive into the data. And I feel like with the UC Davis program, as well as working with Chris and his team, we've been able to really like structure what we need to understand and just like deliver our project successfully. That's like continuing to this day still. So thank you so much, everyone, and especially Chris and my team for working together in such a great project. That's it from us.
Great, fantastic. Thank you so much. And we have a question for Chris. Chris from the pharmacy, are you here with us?
Yeah, I'm here.
Can you tell us what has been the biggest benefit? Because the pharmacy has been a long-term partner. It's several years that you have been partnering with us, and we're grateful for every single one of them. What has been the biggest benefit of such a long-term sustained partnership?
I think the biggest benefit is definitely being able to like impart or like get their knowledge from the students from a business like analytics sense and translate that from a clinical perspective, because all of our staff here really focused on getting the best to the patient and making sure they're clinically all right. And sometimes we forget about that business sense because we're so focused on looking at, one direction at the patient. And so working with all of these students, especially year after year, we've come to, be able to give them a better problem year after year, and in that turn get better results as well. I've definitely seen the students improve year after year, and so it's always nice to see what they come up with in their perspective on things as well, which is something we never get to see in our little world here. in healthcare.
Great. Thank you. And people sometimes ask us, did you guys actually get it to work? Like, is there really some pharmacist somewhere who's using a UC Davis student product? How would you answer that?
Oh yeah, I mean, especially this one, it's definitely one of our supply managers in the cancer center, using this product to make sure that we're properly stocked. And like the students were mentioning, each one of them can be 10,000. Some of them can be upwards into 6 figures for one dose. And patients, you know, every day are coming in for multiple doses of these. And so every dose is super important. And it's really improved our turnaround time, so to speak, because we could, you know, we have all the data, but we didn't know how to put it all together. And so we've definitely got some positive feedback from, you know, our pharmacist in that space saying like, this is really going to help improve my workflow going forward and making sure we can get our patients our medications.
Excellent. Well, thank you so much for sharing your data with us and for your long-term partnership. We very much appreciate it.
Yeah, thank you. And thanks to the
Thank
team as
you.
well.
Yes, huge round of applause for Team Pharmacy.